The road to net zero. The NHS was the world's first national health system to commit to carbon net zero, a mammoth task it aims to reach by 2045. While governments tackle the systemic changes needed to decarbonise the public sector, what can individuals do to help reach these goals? This article for the Podiatrist was written by Katie Smith. Introduction. In early 2024, for the first time, global average temperatures exceeded 1.5 degrees Celsius of warming for an entire year. Data from the EU's Copernicus Climate Change Service also shows that this April was the 11th consecutive record-breaking month for global temperature, while global sea temperatures have hit record highs for 13 consecutive months. The healthcare sector accounts for more than 4% of worldwide greenhouse gas emissions, including carbon dioxide. If it were a country, it would be the planet's fifth largest emitter. The US alone is responsible for 1/4 of global healthcare greenhouse gas emissions, more than any other nation's healthcare system. The NHS makes up approximately 5% of England's total carbon footprint and 40% of public sector emissions. 4 years ago, it became the world's first national health system to commit to achieving carbon net zero. Net zero means reaching a balance between greenhouse gas emissions produced and the amount removed from the atmosphere. Whether the NHS will hit these targets isn't yet clear. The latest available data from just 1 year into the process suggested it was on track. However, this was largely due to government efforts to decarbonise UK electricity production. But grassroots projects are already having a major impact in workplaces up and down the country, with many small changes leading to big results. Those taking the lead tell us more. Part 1. The Big Picture. NHS net zero projects range from a £50 million LED lighting replacement programme and the development of electric ambulances, to powering buildings using renewable energy and recycling more. To help achieve the smaller-scale projects, since 2020 the NHS has been running the Chief Sustainability Officer's Clinical Fellow Scheme. Open to allied health professionals, AHPs, along with doctors, dentists, midwives, nurses, pharmacists and others, clinicians learn about leadership, management and policy before leading projects that contribute towards net zero goals. Once the secondment ends, they return to their clinical role, empowered to drive forward sustainable healthcare. One of the current cohort of 10 clinical fellows is Samantha Holmes, a speech and language therapist specialising in head and neck cancer rehabilitation. There's a two-way relationship to sustainability, Samantha says. We as a healthcare system contribute to climate change, but climate change contributes to the burden on the healthcare system. The byproducts of climate change make people unwell, and they're going to make more people unwell as the climate crisis accelerates. Climate change is predicted to cause an additional 14.5 million deaths worldwide by 2050. Rates of asthma, Lyme disease and encephalitis are predicted to rise as temperatures increase, while poor air quality directly caused by climate change has been linked to heart disease, strokes and lung cancer. During the summer of 2022, when parts of England hit 40 degrees centigrade, around 3,000 excess deaths associated with heat occurred. Samantha says, "We have a role in treating people who are affected by climate change, but we also have a role in reducing our impact and contribution to it." Part 2. Positive influence. With more than 100 members, the college's sustainability network is open to podiatrists interested in practicing and promoting environmentally sustainable healthcare. Wendy Briggs, podiatrist and clinical procurement and quality assurance specialist at NHS Supply Chain, and Katie Harwood, professional support officer at the college, are both part of the network. Katie explains, "We want to get a proper conversation started within the podiatry community. We want to find out about good practices that people are doing so we can shout about them and roll them out in other areas." Wendy says the role of the individual is important. but ingrained practices that may be harming the planet reach far wider. She adds, "We have to recognise that a lot of carbon-generating activity happens higher up during the manufacture and supply of products and the production of services we all use." Podiatrists will notice changes within the provision of services, Wendy says. For example, the NHS is starting to use reusable sharps containers. These are a different colour from the usual because recycled plastics are being used during manufacture. Katie says, "The biggest part of carbon production is in manufacturing. That doesn't mean podiatrists and other AHPs should stop doing things, but we also need to be lobbying Parliament and putting pressure on the higher echelons of the political system and big businesses. Manufacturers are then influenced to change their production." Podiatrists are also well placed to have conversations with patients about sustainability and reducing their personal carbon footprint. Katie says, "There are only 12,000 podiatrists in the country, so we're not going to have a massive impact. But most podiatrists will see 20-plus patients a day, 5 days a week. That could be hundreds of thousands of people being influenced. If they see you modelling sustainable behaviour, some initiatives will get taken up." Part 3. Practical ways to go green. Green grants are available to small businesses, Katie advises. For example, if you're doing home visits and you need some money towards electric vehicle infrastructure, then you can apply. She says, "It's about podiatrists making themselves aware of all these little opportunities." AHPs are already engaging in a range of sustainable practices, from reducing packaging to using e-bikes for short journeys. Within speech and language therapy, Samantha says she knows of a team that redesigned its laryngectomy pathway to offer domiciliary follow-up care, rather than requiring patients to come into hospital. Samantha says, "There have been high levels of patient satisfaction because they've not had to travel for their procedures, and big carbon savings because of cutting down on outpatient and staff travel. We don't need to redesign the wheel. There are a lot of things that other AHPs are doing that could translate into different services." Wendy agrees. She says, "There are lots of ways that people can improve sustainability in their practice and reduce cost at the same time. Examples include using fewer pieces of disposable equipment such as gloves when they aren't necessary, swapping out disposable wipes, and avoiding single-use plastics." Cynthia Formosa is Associate Professor at the University of Malta's Faculty of Health Sciences. She recently co-authored a paper entitled "An Advocacy Towards Green Podiatry, Call for Change to Save Our Planet." The aim of the paper, she says, is to create awareness. Among the changes suggested in the paper are making use of telehealth, installing solar panels, choosing footwear made from sustainable materials, and encouraging patients to use active travel options instead of driving. Cynthia says, "When we were looking at raw materials, we found things like organic cotton, natural rubber from bamboo trees and recycled plastics, all greener options than traditional plastics. We are also moving towards teaching our students to manufacture orthotics with 3D printing, where there is no dust or grinding involved. Financial incentives could also help podiatrists who run their own businesses to adopt such measures. Certain energy-efficient and zero-carbon technologies, like solar panels, can be claimed as capital allowances, lowering a business tax bill." Part 4. Healthcare without harm. With the NHS under intense pressure and private practices overburdened as a result, is now the right time to focus on climate change. Katie says, "Sustainability is not only going to save the planet, but it will also keep people healthier. People are literally dying from poor air quality, especially in bigger cities. That impact on people's health also affects their circulation and then their feet. Making preventative changes for the good of the climate could prevent worsening health and greater overburdening of health services in the future. At the same time, sustainability mustn't become a box-ticking exercise. Samantha says involving patients in the journey to net zero is crucial. She says, They need to be reassured that net zero won't mean poor quality or less effective healthcare. In clinical care, nothing should ever be done just because it's more sustainable. It should be done because it's better for the patient and better for the planet. We need to be careful, she warns. A lot of people see digital healthcare as the answer to everything, but we have patients who aren't digitally literate or don't have access to the internet. We can't make these sweeping changes and leave half of our patient population out in the cold. As AHPs, we have long-term patients on our caseloads. We know them, their families and social environments. We're well placed to make those changes in a way that brings the patients along with us. Part 5. AHP Case Study. Nikki Edison is an associate professor at Staffordshire University's Centre for Biomechanics, a consultant orthotist and orthotic service manager at the Royal Wolverhampton NHS Trust, and chair of the British Association of Prosthetists and Orthotists. Nikki was part of the orthotics team at New Cross Hospital that won the Greener AHP Award in 2022 for making the department more environmentally friendly. Changes included the introduction of telehealth, changing packaging from one of their suppliers, using an electric van rather than large couriers, implementing separate waste bins, using more recyclable materials, and adopting paperless triaging and ward logs. Nikki says, "We used to receive every ankle-foot orthosis in a plastic bag with an individual note. We realised the plastic bag was unnecessary, and the delivery note was a duplication of the main note that listed all the devices delivered. We also used to get each item separately, which meant we would be receiving dozens of deliveries from couriers on a daily basis. We changed to 3 bulk deliveries a week, using our supplier's own driver rather than a courier." Between March 2020 and September 2021, the changes resulted in savings of 151,913 miles of patient travel, a reduction of 5,621 car parking spaces, and a decrease of 28 tonnes of CO2 emissions in the local area. Nikki says, "We all have a part to play in reducing the NHS carbon footprint. Even small changes can have a big impact. Look closely at the details of how your service runs. You'll be surprised how many small changes you can make that accumulate significant carbon reductions. Think small to begin with and start with changes that don't cause significant changes in practice. When people start to realise the impact they can have, enthusiasm and new ideas will follow.